I've been a physician for over 2 decades, but every so often a case comes along that challenges everything you think you know. That's what happened with Alex, a 34-year-old woman who walked into my life at the height of her illness. It started on a chilly December evening when I first met her in the emergency department. Alex looked exhausted, pale, and visibly in pain. Her voice was barely above a whisper as she described her symptoms: fever over 39 degrees Celsius that had persisted for a week, joint pain in her knees, wrists, and ankles, and a sore throat that wouldn't go away. "Alex, I just want this to stop." I could tell this wasn't just another routine case of the flu. Her symptoms didn't fit neatly into any box. The salmon-pink rash on her arms and chest caught my attention. It appeared during her fever spikes and disappeared just as quickly. Her lymph nodes were swollen, and her liver and spleen felt enlarged during the physical exam. I ordered the usual tests: blood work, imaging, cultures. While waiting for the results, I learned that Alex had already tried to treat herself at home with antibiotics and NSAIDs, but they hadn't helped. Her fever never dropped below 38.5 degrees Celsius. The lab results came back, showing a severe inflammatory response, elevated ferritin levels, low platelets, and markers of significant immune activation. But the blood cultures were negative, ruling out a clear bacterial infection. This wasn't an ordinary fever, something more complex was at play. Over the next few days, Alex's condition deteriorated. She became hypotensive, her blood pressure dropping dangerously low despite aggressive fluid resuscitation. We had to transfer her to the intensive care unit. By then, I had a working diagnosis: fever of unknown origin, likely autoimmune or inflammatory in nature. But the challenge was figuring out exactly which condition. Was it an aggressive infection we hadn't identified, or was her immune system attacking her own body? The turning point came with a bone marrow biopsy. The results confirmed what I had started to suspect. Alex had hemophagocytic lymphohistiocytosis, or HLH, a rare and life-threatening condition where the immune system becomes hyperactive and starts destroying healthy cells. But HLH doesn't just appear out of nowhere, it's usually triggered by something else. For Alex, all signs pointed to adult-onset Still's disease, a rare inflammatory disorder. Her fever, joint pain, rash, and swollen lymph nodes fit the picture. We immediately started treatment with high-dose steroids and chemotherapy, following a protocol used for HLH. Alex's body had been fighting itself for so long that it took some time to see improvement. But slowly the fever resolved, her blood pressure stabilized, and her joint pain eased. 2 months later, she walked into my office for a follow-up visit. She was thinner, weaker, but alive, and grateful. "Alex, Dr. Shoo, thank you for not giving up on me." Alex's case was a reminder of the complexity of medicine. It's not always about finding the right answer immediately. Sometimes it's about asking the right questions, working through the possibilities, and trusting the science, and your instincts. As a physician, you don't always get to see the impact of your work. But watching Alex walk out of my office that day, healthier and on the road to recovery, was one of those moments that reminded me why I chose this path in the first place. And as for Alex, she continues to improve, her strength returning little by little. Cases like hers teach us that persistence pays off, not just for doctors but for patients too. Please like and subscribe for more interesting content.